Hello and welcome to Berks Career and Technology Center, the Protective Services Program of Study. We're going to introduce you to the Emergency Medical Services Program of Study, where we teach students how to be emergency medical technicians. These are the individuals that are responding to your emergency when you call 911. Through this information session, you'll be exposed to the different skills and techniques that these students are exposed to during their year here at BCTC. In the Emergency Medical Services Program, students are taught how to assess patients. They assess for medical anomalies as well as traumatic injuries to the patient. They do this by physically touching the patient, looking for specific signs and symptoms that might be ailing the patient. Emergency medical technicians are taught how to assess vital signs. They take blood pressures, heart rates, listen to lung sounds, and ascertain if the patient's in distress with these vital signs. An emergency medical technician is capable of drawing blood to sample it for blood glucose monitoring. They do this by pricking the finger and drawing a droplet of blood and then measuring it. Students are taught cardiopulmonary resuscitation. When a patient is lifeless, without pulse, without breathing, EMTs are called to resuscitate the individual. They do this by doing chest compressions, rescue ventilations, the use of an automated external defibrillator, and other tools that are available to them are suction units, airway management devices, and oxygen. In order to provide lifelike training, we have high-fidelity simulation mannequins, such as TraumaHow, that allows us to interchange traumatic injuries, such as amputations, uncontrolled bleeding, and other injuries. This addition to our program provides a high-stake education for the students that are entering the Emergency Medical Technician program. Emergency Medical Technician students are taught maternity. They're taught how to deliver babies in the field. So that way when someone calls 911 and needs to deliver immediately, they have that ability and have that training and skill set. After about 200 hours of training, these students are prepared to respond to 911 calls for medical emergencies, traumatic emergencies, disaster preparedness, motor vehicle collisions, and anything that you may need 911 for. This course of study prepares the student for testing at the state and national level. These students put their heart and soul into a program so that way they can one day answer the call when you need their assistance.